Yeah, I'm turning on Facebook now, Carrie.
Perfect. Yeah, so hello everyone and welcome to the first post-primary Zoom town hall. Tonight, Sue will be having a conversation with Elaine Frank. Elaine Frank is an injury prevention and public health professional who has focused her most recent work at the intersection of firearm safety and suicide prevention. She's also the co-developer of CALM, which is the Counseling on Access to Lethal Means. She's also the co-chair of the New Hampshire Firearms Safety Coalition that has created the Gunshot Project and other efforts to engage the firearm community in preventing suicide. So I'll turn it over to you, Sue and Elaine now.
Great. Thanks, Carrie. Elaine Frank and I have known each other, I don't know, since what, 1992? When Elaine was the director of injury prevention at Dartmouth. And through our respective careers, we've continued to keep in touch and collaborate on projects. And actually, through my work at the American Trauma Society, I reached out to Elaine to talk with members of our national audience about New Hampshire's Gunshot Project, because it is a unique, and as in our title for tonight's town hall, it's a unique bridge building towards firearm injury prevention. The Gunshot Project started in New Hampshire, and we're seeing that it's moving throughout the country. So it's an important common sense approach. Although we're starting the conversation tonight about suicide, and this is Suicide Prevention Month, when we wrap up, I want to talk about a couple pieces of legislation and areas that have to do with firearm injury prevention and gun violence that I have an interest in bringing about some prevention, moving towards some more preventative measures with. But our conversation is going to start tonight about this bridge, and these bridges that have been built that are unique to New Hampshire. And Elaine and I actually both used to sit on the Youth Suicide Prevention Coalition with the that was hosted in New Hampshire as a multidisciplinary group that really, took a hard look at all sides, from family to mental health care providers to the medical examiner's office, to really get a better understanding of how and why this was happening. Suicide by firearm is a public health problem, and it affects the entire community. And just like when you talk about heart attacks, the way we started bringing down the death rate related to heart attacks is that we talked about what the warning signs were, and we were very public in those conversations, so people knew what to look for and they could respond to it. And that's the same kind of thing that we're doing here tonight, and we're doing when we talk about CALM and when we talk about the Gunshot Project. So in New Hampshire, it's not unlike other states when we're talking about there's unintentional injuries. So those are crashes. We know in injury prevention, Elaine and I don't like to use the word accident, although I know a lot of other folks do. So those are things like car crashes, but then there's intentional. So when we look in New Hampshire and we look at the second leading cause of death, and it's intentional, it's going to be suicide. And the lethal means, the method that folks are using, this is up to the age of 34, is a firearm. And up to age, I think it's fourth or fifth when we're talking about up to the age of 55. And this is according to the Partnership for Public Health here in New Hampshire. So I wanted to kick off the conversation saying that this is a public health problem, that in order to drive these numbers down, we have to address it in a holistic and bring partners into it. We have to talk about what the warning signs are. And I think one of the most important parts of the conversation tonight, I mean, we know that this is, one of the top leading causes of death, that it is intentional. And we know when we talk about suicide that firearms in particular are the lethal means by which this is happening. I think it's important for us to look at the partnerships that can be built to bring about a common sense approach. And that's when I turned to probably one of the people, and again, I've known her for a long time, but I know brings great common sense to these conversations, is Elaine Frank. So Elaine, she's the co-chair of the New Hampshire Firearms Safety Coalition, brought the Gunshot Project to life, and she's going to talk about CALM, the Counseling Against Lethal Means. So Elaine, I'm going to turn it over to you.
All right. Thanks, Sue. So let's just start with a little bit of data. I won't get too heavily into it, but as Sue said, suicide is the leading cause of death for young people, and firearms is the leading method used for suicide in the state. In fact, when you look at suicide or firearm deaths in New Hampshire, you really need to be talking about suicide. In fact, 90% of the firearm deaths in the state are suicides. So homicides are a small group, about 9 to 10%. And those accidental or unintentional deaths that Sue was talking about are really very, very small, because firearm owners and others have done a really good job at keeping firearms, for the most part, out of the hands of people who shouldn't have them, particularly young kids. But when we're talking about suicide, we're talking about slightly older people. We're talking about teenagers. We're talking about people in their 20s and 30s. The peak age for men is middle age. As for women, it is, but women don't use firearms as much. And then there's a real spike in older gentlemen who use firearms to take their lives. So the first thing to know is that if you're talking about firearm safety in New Hampshire, you really do need to be talking about suicides. And the other piece that I think is so important is, while here in New Hampshire, people may vary on how they feel about the use of firearms, whether they think firearms are a good thing or not such a good thing. But the one thing we really do all agree on, with almost no exceptions, is that the misuse of firearms, whether that's homicidal or suicidal, is something we all want to prevent. And from when I started at the Injury Prevention Center, that notion of, so if we all agree on that, isn't there a way that we can work together? Both the pro-gun people as well as the pro-public health and public safety people. And so we started looking at that. We developed the Firearms Safety Coalition. We initially started looking at preventing young people's suicides. Then as years developed, started realizing that one of the things we needed to do to prevent suicide was, as Sue said, help people identify who might be at risk. And when you identify people at risk, apply the low-hanging fruit concept and say, okay, what's the simplest thing we can do to save lives here? And it turns out that colleagues at the Harvard School of Public Health had just recently developed something called Means Matter. And what Means Matter says is, whatever is going on in terms of why you might be suicidal, that is very important. I mean, the intent really does matter. But regardless of the why, it turns out that how you make an attempt is the best indicator of whether or not you're going to survive that attempt, whether you're going to live or die. And so based on that and some other work we were doing, we realized that we needed to educate mental health providers and healthcare providers on talking about access to lethal means, and how, if you're concerned about someone, you can take some steps to do that. So from that, we developed CALM, which is Counseling on Access to Lethal Means. And the idea was that a lot of the providers in our state are not gun owners. I mean, obviously some are, but lots of them are not. But they're patients who are at the most risk of dying from a suicide attempt. That is, if they use firearms. Obviously, those people are firearm owners. And so we realized there was a gap that needed to be bridged, and that was between providers who may not be firearm owners, may not feel comfortable talking about it, and their gun owning patients who need to be spoken to in a respectful, collaborative manner. And we found that if you do that, people are very interested in preventing their own or their loved ones' suicide deaths. That if you approach the firearm community as part of the solution rather than as just part of the problem, you're going to get a lot farther. So this coalition formed. Many others have developed around the country. And I guess if I can, let me see if this is going to work. I want to show you, let's see, can I do this? Maybe. Can you all see my screen? Sue, can you see my screen?
Okay.
Good. So let me see if I can run this video. I want to warn you before I run the video that it starts with 2 gunshots. So be ready for that. I don't know what your volume is. Whoops. It would help if I hit the right buttons. Where are we? Sorry about this. It's always the AB. Oh, I'm no longer screen sharing. Sorry about that.
I can see your.
We're almost there. New share. Let's try it here. Oh, you know what? I think it's. It worked before, didn't it, when we tried it?
Yeah. Hit your escape and try again.
Hit my escape and try again. Live, stop share, resume share. That's what I want. Sue P.
That's me. There you go.
We got it now?
We're good. Yeah.
Okay, let's go slideshow. Wrong current slide. Okay, so be prepared for a couple of gunshots. But let me tell you, this short PSA was developed by a similar coalition in Utah. And it really does, I think, show a lot of the reasons why we say means matter. So listen carefully to what this gentleman is saying.
Last year I was at my lowest, going through some pretty serious depression. A couple friends of mine stopped by the house and said they were worried about me. Said they'd feel a lot better if they could hold on to my firearms until things turned around. I think they saved my life.
If your loved ones are struggling, talk to them about temporarily storing their guns away from their home, because things do get better.
So, any reactions to that video? Can people talk?
Yeah, I think we can take them off mute.
Yeah.
Liza Draper has her hand raised. Liza, let me see if I can bring you in. Here you are, allowed to talk. Go for it.
So I just wanted to say I thought that was a pretty powerful PSA. And one of the things that seems to be hardest is to get people to make that visit and make that statement to someone that they think it would be safer to be without weaponry.
Mm-hmm. And one of the things we found is that focusing on the temporary nature is very helpful. Here is a gentleman who recognizes that he was at risk, recognizes that his friends took this step, and now things are better. And what's he doing? He's back to shooting. What else did you notice about the video?
Well, he's obviously a gun owner. Like he knows what he's doing.
Yep. Yep. And he uses safe equipment, PPE, for shooting. And the other thing is, he was going through a bad time. He is now better. Things improved. This was not, he didn't die from an attempt because he didn't have access to guns, and he recognizes his friend's role in that. So, Liza, I agree. I think from my perspective, this is one of the most powerful PSAs I've seen, because in 30 seconds, it sort of tells you everything you need to know. And one of the major things is that friends and family can make a huge difference. Now, when we're talking about this, we're not always saying that they have to be removed from the home. They can be made less accessible. Our guideline in doing this work is the tagline that hold on to their guns. If you're concerned about someone, a family member or a friend, hold on to their guns. As you can see, suicides in New Hampshire outnumber homicides. We talked about that. They're the leading method. And attempts with a gun are more deadly than with other methods. So firearm owners die by suicide more often, not because they're more likely to be depressed or have mental illness, but because an attempt with a firearm is far more likely to result in a death. This poster, yep, go ahead, Sue.
So that's about access.
Yep.
Okay, and actually, I'm going to let you talk about this because I think you're going to answer my question.
Well, ask your question.
Well, just it kind of it tags on to what Liza had stated. You know, it's how do you? Well, it tags on. How do you? What's the best way to get somebody who's struggling, who's resistant, but you know they need help? And I think you're going to talk. I mean, how do we get them to move forward in this conversation? We're not even talking about a gun shop right now. We're just talking about this counseling. And we're talking about untrained, friend to friend, empowering people to have these conversations.
To be very honest, I think within the firearm community, which is clearly the best place to do this, if I'm a firearm owner, I'm much more likely, like the gentleman in the video, to listen to my gun owning friends, where I don't think that they're out to get my guns, right? That's not the thing. They're not anti-gun. They're anti-suicide. And I think that's really the message that we have to get out. And it's what we've been doing here in New Hampshire, is educating folks that we are anti-suicide. And when we talk about reducing access to lethal means, we're not talking about forever. We're not talking about taking away your right to firearms. We're just saying that for the time being, you are going to be safer if there is time and distance between you and your gun. One of my colleagues makes the comparison to, if you're going on a diet, right? What's the first thing you should do? Well, you should get the Ben & Jerry's out of your freezer, right? And we all know that we can go to the store and get more Ben & Jerry's if we're so inclined. But at that weak moment when you're going, oh, I would really like some ice cream, if you just have to go to the freezer, it's much easier than if you have to put on your clothes and find your keys and so forth and so on. I don't want to belabor this. But the idea is that the more time and distance people have to go to get that firearm, the better. And that's because of four things. One is that very often, the acute suicidal crisis doesn't last very long. 10 or 15 minutes, and when somebody moves from thinking about suicide to making that attempt. If during that time, something intervenes, that may save their lives. Number two, some methods are far more lethal than others. Almost anything you do besides firing a firearm is going to be less lethal. You're going to be less likely to die. The third thing is that most people who survive that attempt, right? So they've used something less lethal, or they've taken some time, or they've changed their mind. The overwhelming majority of them, 90%, will not go on to die by suicide. And fourth, the other thing we know from people who've survived lethal attempts is that almost all of them agree that they were ambivalent, that they wanted the pain they were in to stop, right? But they didn't really want to die, not forever, okay? And it's that ambivalence you have to work with. If you're worried about someone, the thing to do is to say, I'm worried about you. Are you worried about yourself? Right? Are you concerned that in a weak moment you might do something you regret? Let's talk about that. Can we talk about that? You know, what can we do to put a little time and distance between you and your firearm? How's that? Lisa, what do you think? Liza, excuse me.
That's okay. I think it's really important to model that process for people.
Yep.
It doesn't come easily to
Right.
many of us to suggest to someone, whether they're a member of our family or a friend, that perhaps they're having mental health issues.
Right.
And therefore, I think people are reluctant to take that step. So I think it's very helpful that you just modeled how to do that.
Right. And a lot of suicide prevention work really focuses on helping people. What's the line I heard the other day? Helping people feel comfortable with uncomfortable conversations. Okay. That, you know, it's not comfortable, but you know what? Most of the time when you have that conversation, the person at risk feels better simply because you've had that conversation. Let me tell you a little story from, do we have time for a little story, Sue? You're muted.
I was just hoping we could get you to stop sharing your screen so we could see you in big screen.
Oh, God.
Okay,
All
good.
right, there we go.
Thanks.
So, you know, I'm in a book group like many people at my library, and we were talking about a book called A Man Called Ove, which is about a gentleman who was suicidal, and he made a number of attempts, and each one of them was thwarted. And finally, he was befriended by his neighbor, who really made the difference in him feeling suicidal because he no longer felt alone. And while we were talking about the book, there's a woman in my group who was looking like really uncomfortable. And at a certain point, people asked me to talk about suicide, and I started talking. And when I was done and somebody else started speaking, she got up and left the room, gathered her things and left. And I went up to her and said, you know, are you okay, in the hallway? And she said, she looked at me with tears in her eyes and she said, no. We started talking. She said, well, you know, nobody knows this, but I've been suicidal. And the way people, not you, but the way other people were talking about it, like, oh, nobody would really do that. Nobody would attempt a number of times. Nobody really thinks that way. She said that was really hurtful to me. And so we started talking, and she told me that she'd been in therapy for 7 years and so forth and so on. And we went on. And at a certain point, you know, we exchanged phone numbers and so forth. And then she said she was going to meet a friend for lunch. And I was like, oh, that's great. Okay. And she said, you know, Elaine, this is the first time I've ever talked about this to anyone. And I went, well, wait a minute, I'm confused. You said you'd been in therapy for 7 years. How can that be that you know, why are you saying you never talked about it? And she said, oh, I would never talk to my therapist about it. I'm afraid that she would put me in the hospital. And I was just totally taken aback. And she said, you have no idea, just talking about it, having another person know how I've been feeling makes me feel so much better. It's a long story to say, you never know when your question or your invitation to someone to speak is going to be the time that makes the difference.
It's really powerful.
So let's get back and talk about guns.
No, thanks for sharing that. Thank you, Elaine. Yeah, that's really powerful. And the invitation to speak is so important.
And I think that it is true, Liza, and I'm not downplaying your concern. I mean, the first time you turn to somebody and say, have you been thinking about, you know, taking your life? Have you been thinking, or one of the ways you can ask is, do you ever think like you'd like to go to sleep and never wake up? because people say that that's kind of what they feel. They don't really want to do anything actively, but they don't want to wake up again tomorrow. The more you do it, the more comfortable you feel, then the more comfortable the person feels, and the more you can work on it together.
I just wanted to share that as a paramedic that's worked both in the field and in the emergency department, I've had this, I've had this training, but it has led me to have these conversations with people about, and it is actually really tough to get these words out. Like, do you, you come into a situation, you're even remotely suspicious that they're thinking they may not have done anything yet, but somebody, either they called or somebody called because they were concerned. So just even asking them, have you thought about taking your own life? And then do you have a plan? And hearing from people that yes, they have thought about it, and yes, they have a plan. And some people are so far into this that they are detailed about it. So then there's the whole process of getting them to where they need to be, and the way that say the system that we have or don't have to deal with mental health issues, and especially when somebody is at this point in a crisis, is a longer conversation, but not just friend to friend. I've actually professionally have had to engage in it, and it's never easy. And hearing the responses are pretty tough. But when you at least they feel at that moment that they can tell you, then you can actually move them towards help.
Yep.
Somebody made the call, and then we took it from there.
Yep.
Okay.
Absolutely.
Right. Thanks.
And it's that collaboration. And, we talked about people being ambivalent. If someone, this is my thing. It's like, if they're not ambivalent, if they've absolutely made the decision, they're not talking to you about it. Okay. So it's that ambivalence that you have to work with. And in that situation, it's like, are you, I'm worried about you. Are you worried about yourself? Are you concerned about the moods you've been in, about how low you've gotten, how angry you've been, whatever that situation is. And the more you can ask open-ended questions and get them talking rather than listening, the better, because it's that talking that works really well. If you're interested in getting more into this, there are a number of really good TED Talks. There are two gentlemen, both named Kevin. Kevin Briggs, who was a California highway patrolman who worked the Golden Gate Bridge for many years, and he has a TED Talk, Kevin Briggs on TED Talk. And then there's a gentleman who he talked down off of the bridge named Kevin Bethia, who I understand recently did a TED Talk about the fact that they spent 90 minutes together, and basically Kevin Briggs did virtually nothing but listen, and how that made the difference for him. So there are a lot of good things out there. And I think just recognizing that in general in suicide prevention, as well as in reducing access to lethal means, it can be anybody's job. It can be a therapist, but it can also be a friend or a family member or an EMT or whoever can make the difference.
So we have this opportunity to talk about, this unique project that was started in New Hampshire. That's, a common sense approach, and a bridge that's been built between gun shop owners and the public health community in trying to do like what we did with heart attacks, recognize and use that moment and put some distance in between the person who's coming in to get a weapon because they're thinking like, I'm going to end my life and this is how I'm going to do it. And stopping that, putting that time and distance means matter. So talk us through that, because I've had the advantage of, I have the perspective of talking to people throughout the country who will say to me, "Oh, you're from New Hampshire." They say two things. One, you don't have a seatbelt law, but this
Mhm.
thing, and I'm talking about surgeons who are very, very engaged, the American College of Surgeons, American Trauma Society. They're really engaged in this conversation about firearm injury prevention. And they'll say, you guys have that really neat gunshot project. It's really important. And there's a map. I think it's on the Means Matter website that shows all of the different places. We can maybe get it up in the, Carrie can get it up in the box for us, all the different states that are starting to take this on. So Elaine, tell us about the gunshot project.
So the gunshot project came from this same place, this idea that if we're going to make a difference with firearm suicides, we're going to have to engage the firearm community. They're the ones that really need to take the lead. I often draw a parallel between this and reducing drunk driving. The friends don't let friends drive drunk. We haven't quite come up with the catchphrase, but we're working on it. But it's that idea that if a friend of yours is there at the moment and you're getting ready to walk out their door from a party and he sees you being in no shape to drive and says, let me give you a ride home. Okay, it's really sort of the same concept. And what happened in New Hampshire is we learned that over a very short period of time, a number of people had come to the same gun shop where I happened to know the owner, and he'd been involved with firearm safety with us before, and called him up and said, would you be interested in working on this? And he was absolutely right on it. And so we gathered some folks together and we spent a long time trying to figure out what we could do because nobody was doing this work of bringing firearm retailers and suicide prevention people together. And what we ended up doing was the Gunshot Project. You saw the poster that we developed, but the idea, oh, there we go. I've seen that before. The idea was to say to firearm retailers, you are a trusted source of information about firearms. If we can get you to work with us to just let your customers know about the tie-in between firearms and suicide, and to promote this message of hold on to their guns if you're worried about someone, we might be able to get somewhere. So we started the project, we reported on it, lots of other states have picked it up, and really the thing that I'm really proud of is that a national organization, suicide prevention organization, the AFSP, American Foundation for Suicide Prevention, partnered with the National Shooting Sports Foundation, which is the industry leader for firearms, and have developed a suicide prevention campaign that they've shared with all their retailers. So what's important about that is the recognition that A, nobody wants people to die by firearm suicide, and B, that we can do that, we can make a difference by educating people and by giving examples and moving this thing along. What we're now working on, and you saw an example in that video, which was developed by colleagues from Utah, they've embedded suicide prevention training into their concealed carry weapons permit class. New Hampshire doesn't have any required training, but, and so they're trying to get firearm instructors to talk about suicide prevention from the get-go. And we've got people around the country who are doing that. So if the first time you hear about storing your firearms safely, you're not only thinking about preventing your 5-year-old from getting at it, or the bad guys that are breaking into your house, but also your 15-year-old depressed son, or your 82-year-old father-in-law who is going through a really rough time following the death of his wife, or any of the other people who might be at risk for suicide with a firearm. If we can get that embedded from the get-go, we're going to have a much better time of getting friends and family to A, feel comfortable, and B, be effective. I've been talking a lot. Sue, let me throw it back to you.
No, so talk to me about I think it was, what was it, Riley's and Hooksett? I
Mhm.
retweet. It comes back like it's yesterday, and we haven't, you and I haven't had this conversation probably in
Long time.
2 years, maybe. So when I go into, I'm considering purchasing a weapon, and I go into a gun shop that's participating in this, I'm not even talking about the instructors yet. What might I see? I mean, what's their training and preparation? I know that if I remember, there's the suicide prevention hotline. I actually have that number.
Yep.
I want to make sure to broadcast it and put it
Yep.
out there. But what am I gonna see?
Well, if they're actively participating, what you might see is that poster. You might see some brochures about the 11th commandment. You might see some cards with the lifeline number on it. But the other thing is that if somebody is selling you a firearm, and I should say this is not limited to suicide. Firearm shop or gun shops, especially the smaller ones that are really responsible and know about firearms. The first question they usually ask people is, why are you buying this gun?
Do they really?
Yeah, because just think about it. If you're buying hiking shoes, right? They'll say, what kind of hiking do you plan to do? Do I want to give you something heavy duty? Do I want to give you something light? Do I want to give you something waterproof? Blah, blah, blah. Same thing with firearms. If you just sort of ask that random question, what are you looking to do with this gun? Or, what's the purpose you have in mind? Or what kind of training have you had? What kind of guns have you used, et cetera? Just as an icebreaker, in fact, Ralph D'Amico from Riley's tells a story before he got involved in this. And he talks about a woman who came in and she was looking a little shaky. She didn't look like his usual customers. She was in her early 60s. And he said, and she walked in and she said, I'd like to buy that gun. And he was like, that is kind of weird. It's like, I want to buy those shoes. It's like most people want to try something on. They want to talk about it. They want to hold it in their hand, whatever. He looked at her and he said, should you be buying a gun? And she burst into tears. Okay, so again, it's asking the question that makes people say, oh, no, I really shouldn't be buying this gun. And she then told him her story about being suicidal, and he didn't sell her a gun. So what you'd see is somebody who is thinking, adding to the things they think about in terms of criminality, in terms of alcohol and drug use, including no experience with handling a weapon, no instruction in firearm safety. What they're doing is adding the thought of suicidality to what they're screening for.
So I'm a gun shop owner and I want to get involved in this project. I hear about it. I have interest. Obviously in New Hampshire, there's a lot of conversation.
Mm-hmm.
Where do I start?
Hopefully you have gotten materials in the mail. We did a mailing just this past October. And what we're really trying to do, though, our next step is to get people, gun owners, gun guys, as I usually call them, although some of them are girls.
Girls.
To go to gun shops and engage people in conversation and because mostly the gun shop owners, they agree with the idea of preventing suicide. I mean, they don't agree that necessarily that they want to ask everybody if they're feeling suicidal, right? But they have been doing this for a long time, and they can spot someone who maybe shouldn't be purchasing a firearm. One of the things we find that's difficult, and it's true with all of suicide prevention, is we want everybody to feel empowered to ask the question, but not responsible. We can't be blaming people if someone buys a firearm and then ends up taking their life. At Riley's, one of the initial people Ralph looked at a videotape. This gentleman spent 52 minutes purchasing this firearm, okay? And Ralph said, even knowing that within a couple of hours he had taken his life. He said there was nothing in that man's, expression, language, body language, nothing that would have given him the slightest pause. So it's not this is a part of prevention, but it is it's not, excuse the pun, it's not the magic bullet.
So what about, I know this is kind of a completely different area, but, gun shows and some of the shop owners participating in those, and do they take the message there as well?
Yes.
Okay.
We haven't done a gun show in a while, but most of the people who are set up at gun shows are in fact licensed firearm dealers. And in fact, they do have to do a background check. And we have reached some of the gun shops that way, and we've reached some people, although to be honest, most people go into the gun show are not really interested in talking about suicide prevention. Understood.
Okay.
Yeah. Although the ones who are really happy to have someone they can talk to about it.
Okay. And I should have started the conversation off this way, but in building this bridge, this unique coalition, I mean, how did you get everybody together? I mean, Riley's was the place, where it really, when you read about it, it gets off the ground. But considering that sometimes these camps can be, when you start talking about, let's just be frank, you start talking about guns, there can be immediate posturing. How did you break through that? How can others break through that? This isn't a threat. It sounds like it's a team approach to a public health issue. And
absolutely.
I'm interested in it. So,
and I think you just have to, I mean, in New Hampshire's case, we had already had this Firearms Safety Coalition. And when I made the call to Ralph about working on suicide prevention specifically, he and I had already been working on youth firearm safety for a while, so we had some trust. But I think the basic thing is, when you're talking about the politics of firearms, what you're usually hearing is the 5 or 10% on the strongly pro-gun side and the 5 or 10% on the strongly pro-gun control side, if I can use that term. But the vast majority of people, whether they own guns or they don't own guns, are somewhere in the middle, okay? And the one thing, as I first started out by saying, is what those people have in common is a real desire for people not to die by firearms, whether it's suicide or it's homicide. And so to me, it's saying, okay, let's not talk about all the stuff we disagree about. Let's just not talk about it. We've been doing this version of the coalition for over 10 years. And I can tell you that we don't talk about elected politics. In fact, I laugh when we were meeting at Riley's at one point, and I came out of his shop. And Riley's, by the way, is no longer there. But I came out of the shop, and he had all these political signs up, right? It was like end of October. And I looked around and realized that of the people that were up there who I could vote for, I was voting against every one of his people, okay? So we are politically in very different camps. But you just say, okay, let's set that aside and let's talk honestly and forthrightly about what we agree on. And let's go as far as we can on what we agree on. And you can go pretty far.
Okay. So Elaine, there's a couple of questions, and I think the first one I'm going to take, it came through Facebook Live from my friend Mary, wants to know whether New Hampshire has a red flag law. So Mary, the red flag law did pass. It passed the legislature, was vetoed by the governor, and in veto day last week, they were unable to get the supermajority to override it. And if people don't know what a red flag law is, and at the beginning, Elaine and I were kind of talking about some of the things that I wanted to, cap as we move forward towards the end, because there are pieces of legislation that I'm interested in as locally and hopefully as a state elected official to dig into is going to be a red flag law. So it's extreme protective orders. It's a administrative procedure that you can establish an administrative procedure if you believe that somebody is suicidal or somebody is homicidal. And this applies to friends and to family members or to law enforcement. So how that gets worked out between how the law is written and administrative rules. Moms Demand Action, it's a gun group. I always remember them as that they stand out because they wear the red t-shirts and they sit. A few of the political events I've been to during the presidential primary in particular, they were always, they're great to deal with. They're always in the front row. But that's a piece of legislation in New Hampshire that they really worked hard, and we were able to get it across one finish line, but not across the final one. So it was vetoed by the governor, and they were unable to override the veto. So Mary, we don't have a red flag law here in New Hampshire. And let's see, Jean Fay, she's from Enfield, says, important discussion. Thank you. How many of the guns used in suicide have been recently purchased?
Good question. I actually happen to know the answer to that. Well, I know part of the answer. When we first started, we looked at all of the firearm suicide deaths and looked in the medical examiner's files to see. Part of the problem is that information is often not recorded because that's not what they're looking at. They're not looking at, it's not a crime in the sense of a homicide. So they're not looking at where the gun came from. But from what we have seen, it's probably somewhere between 8 and 10%, a relatively small number. Most firearm suicides use existing firearms that are in the home. In the case of young people, over 80% of them, about 85% of the firearms belong to the kids' parents.
Okay. So I want to talk a little bit about, here's my daughter calling me on FaceTime. She's, no matter what I say, these are the protected times. She's okay. Actually, you know where my daughter is? She is going to see, she's in Washington, and she's going to pay her respects to
Ruth Bader Ginsburg,
lying in state. So so she is representing for our family and for some of the folks.
And for me.
And yep. Tonight. So thank you, Phoebe. Okay. I want to talk a little bit about, so I talked about the red flag law, which again, I support that based on my experience, not only as a paramedic, but as a medical examiner. I'm a deputy medical examiner. I cover Grafton and Sullivan counties. And so I have seen situations where people have taken their lives by firearm. I've also seen where people have taken their lives by hanging themselves. And in the cases that I've seen, there were very distinct clues along the way, but the inability to connect the dots in a timely way. And they were, and I don't have a lot of experience with this, but what I do have is experience with, they were always very quick decisions. And that's something that you mentioned before. Yep. So, and again, I've had this opportunity to interact with patients both in an emergency department and in a pre-hospital setting when they are in crisis. So I'm not speaking for you, I'm just speaking for me. I do support the moving forward with extreme protective orders. Safe storage, I just wanted to touch on that. You mentioned it. Safe storage is only legislated in, I think, maybe 7 states in the nation. Massachusetts is probably the only one that does what is considered truly safe storage, where firearms are locked. They're in a locked, protected area, and their ammunition is not with them. It's in a completely separate place. So when we talk about safe storage, that's about access, but it's one thing to lock it. It's another thing, the type of lock that you use, and that if the ammunition is removed and not with the weapon. So I just wanted to explain that, because that is When you talk to injury and violence prevention professionals in other parts of the country, this is something that, the safe storage of weapons or firearms is something that we talk about pretty regularly. And last but not least, I can hear her in the other room talking about that she's at the that she's just coming out of the coming out of the Capitol. So we talk about safe storage, talk about red flag laws. And so the other thing would be, I don't know if you ever heard of gun buyback programs. That's more of a violence than a suicide prevention. So it's a completely different, kind of tip to this. I just wanted to turn to it for a second. And they're pretty controversial whether they really work or not. I don't know if you have, if you have anything you want to say about it or any experience, but I have a colleague who worked at Yale New Haven for years and was really instrumental in working with putting these, buyback programs into place to take firearms off of the street. They were turned in, just like we see prescription medication is turned in, but there's the literature is mixed on it. So I don't think I think safe storage is probably an approach that more people can get themselves around from a family perspective than they can this buying back of weapons. It just really hasn't completely proven itself out. Any thoughts on that?
So we have colleagues in Worcester, Mass, who've really been working a lot on gun buyback programs. They do an annual thing. I have mixed feelings about it. I mean, like many of these things, most of the guns that they get are not currently in use. They're not, they're not the gun that somebody would be using for suicide or homicide. But I do think that it's, it's a good vehicle for getting people's attention about the risk of firearm suicide and homicide. We tried just before I left, or maybe it was after, I don't know. We tried to get a number of police departments to work with us. This was the Injury Prevention Center. And none of the police departments leapt at the chance. I do think that it's, I think its benefit is more in PR and marketing than in actually reducing the number of firearms in our communities. But, I think it's worth trying if you can find some willing partners.
Yeah, there again, it's not well published. It's not well studied. It is I don't think tactic is the right word. Maybe one of strategy. But safe storage seems to have taken hold more, especially at the family level. All right. Sorry, go ahead.
No, I was just going to say, I think safe storage makes sense to gun owners because they don't want their kids to get a hold of their guns. They don't want the bad guys who come in and rob them to get a hold of their guns. And then when you add the risk of suicide and say, okay, so how can you maintain ready access for your self-defense gun, but still maintain control of that gun so your 17-year-old who just broke up with his girlfriend won't use it in an impulsive moment. And so I think that safe storage is really the way we're going to continue to have an impact.
And lastly, thank you. I wanted to just talk briefly about, it was a piece of legislation, not this year, but last year, that talked about local control over firearms on municipal property. It was really aimed around the conversation of schools. And this is something that and Lebanon was actually named in this particular piece of legislation. But I think that that's an important conversation for the House and the Senate to have. And I'd like to see that move forward. I think that it's frustrating as a local official that sometimes we have control over an issue and sometimes we don't. Okay, so like you can vote on whether to put Keno on the ballot, but you can't locally make decisions about whether firearms should be on public, in a school, or a completely different item would be, you can't make local, you can't make any decisions about maybe other forms, trying to be creative in creating another stream of revenue for your community. And those decisions get made starting, at the legislature and move down. So it feels sometimes, it does feel, it conflicts. And so this is, I think, another, when I think about the red flag law, and I think about what, specifically with schools, whether firearms should be in the schools, I really believe are allowed on school property, that's up to the municipalities and the school boards, and it's not, and that's where we should leave it. So I just wanted, those are not your reflections, those are mine, but I did want to make sure and share those. So just kind of wrapping our conversation with Elaine, if anyone has any more questions, it would be certainly, we've got the number up for the National Suicide Prevention Hotline. It's 1-800-273-8255. Firearm injury prevention. This is a public health issue, not just the firearm side of it, but we're also talking about suicide. We've discussed tonight a partnership, and as Elaine talked, there are people on both sides that have disagreements about firearms, but what they all agree on is that they don't want anybody to be, they don't want them to be hurt, and they don't want them to die either by suicide or homicide. This is a great example that's now spreading through the nation about how gun shop owners can work together on a public health problem. And if we can do that here, we can do that with other public health initiatives. So it's always, these are some of the things that I think we probably ate powdered donuts and talked about in the Butler building years ago, but these are worthwhile conversations. And a lot of times how we get things done. And sometimes we do need to take it to becoming a law. And sometimes we can build a coalition and solve a problem and spread it just like you've done here. So I appreciate your time tonight. I don't know if you have any final words or anybody has any other questions for Elaine, but it's always great to see you. You're only
nice to see you.
County. Elaine lives in Newport, so it's easy.
But I don't get to vote for you, Sue. But the other thing I just wanted to say is, if this has piqued your interest, the single easiest place to get more information about Means Matter is at www.meansmatter.org. And you can find out all about Calm and the Gun Shop Project, and you can find ways to reach me if you would like to do that. So meansmatter.org. And thank you, Sue, for having me. And thank you all for listening.
All right. Thank you, everybody. And we'll be back next Thursday night. Our topic next Thursday night, we're gonna talk about mobile integrated healthcare, which it's also, that's a fancy name for community paramedics and their role in mobile testing for COVID, as well as the deployment of getting ready to deploy vaccine. And we're going to use flu vaccine as the first part of the conversation, and then we'll move into talking about what it may be like when we have COVID vaccine available. But there's a process, and so we're going to bring together some folks that are doing this work and talk about it next week. So thank you very much, and be safe out there. Again, 1-800-273-8255. And Elaine put her email in the chat box if anybody's interested in grabbing it and reaching out to Elaine. Thanks so much, Elaine.
Bye.
Bye.